Guard members have stepped up again to help out primary health centers during the crisis standards of care. Thursday, Governor Little called on National Guard, citizen soldiers, and airmen to step into triage roles. This will free up primary health staff to work on the more technical parts of a patient care, as well as get more people vaccinated. The National Guard helped primary care cope with the pandemic 5 months ago as well. Now, we've heard from politicians, doctors, and nurses on the state of Idaho's hospitals during the latest surge of COVID-19 cases. But now we hear from a patient. KMVT's Candice Hare spoke to a husband and wife about their experience at the epicenter of the coronavirus crisis in Twin Falls, the emergency room at St. Luke's Magic Valley.
I was flabbergasted. I was like, well, wait a minute. I don't even have a parking spot. All the handicap spots were full. It looked like a tailgate party. And it was that way from when I arrived Friday night, Saturday night, Sunday night, Monday night. Packed.
Brian is quadriplegic, meaning both his arms and legs are paralyzed. He says he waited as long as possible before seeing a doctor for fear of coronavirus and crisis standards of care conditions in Idaho's hospitals. For him, this was a nightmare realized.
In 27 years of being in a wheelchair, I had never seen anything in my life like this. It was madhouse. No parking, ambulances, 1, 2, 3, helicopter taken off, and then the ERs are packed. And the doctors are going, we don't know what to do. 3 out of the 4 floors, COVID.
Brian's wife, Janine, says she saw incredibly sick people in the ER, including several individuals who were on oxygen. She says the images of what she saw that night still haunt her.
I'm deaf, so it's more of a visual. And that visual alone is still burned into my head about the amount of people that were in this emergency room.
It took over 10 hours for Brian to be transferred from the ER to a room on the non-COVID wing of the hospital. But the feeling of crisis still permeated the building.
While we were there Sunday alone, there was 4 code blues, 3 deaths within a couple of hours of COVID. They announced it over the wing, calling all doctors and nurses to help.
Brian stayed at the hospital for 3 nights. Both him and Janine say during his stay, the burden of the influx of patients on staff and clinicians was clear.
Never have I seen the amount of stress nurses, doctors are all in.
What is happening to the doctors and nurses, other patients, it's quite frankly not fair. This could have been prevented. If you don't believe it, go sit in the parking lot. You will see it for yourself.
Candice Hare, KMVT.